Some of you might be wondering about what kinds of things you should do and how often you should do them. Your doctor is the best person to ask about that, but we can tell you what leading health authorities advise. The American Cancer Society recommends that everyone, including cancer survivors, engage in at least 30 minutes of moderate to vigorous physical activity above usual daily activities on 5 or more days a week. This recommendation concurs with the guidelines of other leading health organizations. The American Heart Association and the American College of Sports Medicine further add to the guidelines that regular physical activity should include activities on 2 non-consecutive days that maintain or increase muscular endurance. And a third component of fitness, flexibility and balance training, has been added recently to some other recommendations. The bottom line is this: a good exercise program is balanced among these 3 components: cardiovascular health, muscle and bone strength, and flexibility and balance. This DVD is structured so that each segment is progressive. If you are brand new to fitness or within a few weeks of surgery, begin with the Getting Started segment. When these exercises and stretches are no longer challenging, move on to the next segment. And the third segment is designed to challenge you just a little bit more by adding a few fun things to your workout. You might want to watch each segment of the DVD before choosing which level seems right for you. But don't let your enthusiasm get the better of you. Be safe and use caution.
We're going to move on now to strengthening the upper back muscles. Nora and Mary Kay are going to step in to demonstrate the bent over row. Feet shoulder width apart, bent knees, bent hips. You're going to bring your upper back all the way down to form a nice tabletop. Straight shoulders, straight hips, and pull elbows right back. Good. Belly button to spine. Breathe out with the work. Excellent. You're really trying to target the upper back, the muscles in between the shoulder blades. Now, if this is a lot of strain on your lower back or your knees, Mary Kay is offering a great variation, the upright row. She's pulling the weights wide with her elbows, still squeezing her shoulder blades, still having a great tight core. That looks good. Well done. Now we're moving on to the arms. We're going to focus on the biceps. Pull up and lower. You have a slight bend in the knees for balance. Belly button pop to the spine. Keep those wrists nice and curled up. And a loose grip on the hands. Now we're striving to do 12 to 15 repetitions per set. If you'd like to add a little more, try a second set of repetitions, or grab a heavier set of weights. We're also going to add a balance element if you'd like. Shift your weight onto one foot and balance, continuing with the same exercise. This is a great precursor to our next training section in level 3.